Thank you for tuning in to our course demonstration of Advantage Clinical's Good Clinical Practice Training, recently updated to reflect the changes in the R3 release from the ICH. During this short video, I will show you our GCP R3 course, as well as discuss some of the features which can help us to smoothly integrate this into your team's training. Let's jump right in with a sneak peek of our course. Afterwards, we will reconnect to review some of our unique course features.
Data lifecycle elements. Procedures should be in place to cover the full data lifecycle from data capture to finalization of datasets. Click on a data icon for more. Data capture. The requirements for the extent of data verification should take into account the criticality of the data entered. Metadata and audit trails. Acquired data from any source should be accompanied by relevant metadata. Metadata is a set of data attached to other data which describe the data itself. Think of when you take a photo with your mobile phone, it attaches the date, time, and location. That's metadata. Validation checks should be considered based on risk assessments and their implementation documented and controlled. Metadata and audit trails should be controlled and accessible at any time. Metadata should be collected automatically and should not be editable.
Advantage Clinical has been a good clinical practice training provider since 2015, and we have trained thousands of students around the globe. Our courses aim to engage our learners through interactive course elements, comprehensive course narration, course knowledge checks, and offering a self-paced learning environment where the student can pick up and continue where they left off, so they can keep on top of their daily duties in clinical research. Let's take another look at a course section, then we will discuss how we can incorporate this good clinical practice R3 training into your team's learning management system. Clinical research is filled with acronyms and unfamiliar terms. Our course glossary allows students to quickly reference unfamiliar terms to allow them to keep up with good clinical practice content. Whether they are wondering what is an adverse event or what is remote monitoring, they can quickly check and keep moving forward in the course. We ensure students have a thorough understanding of the new GCP R3 guidance with a knowledge check at the conclusion of the program. When students achieve a passing score of 80% or greater, they will have access to their course certificate for evidence of training. With our course customization packages, we can adapt the knowledge check requirement and contents to fit your organization's needs. We have trained teams of all sizes over the years, and we are happy to offer training packages for small to large teams. We are able to offer you a quick import of our course files into your learning management system so that you can deliver the course in an environment where your learners are comfortable. For those organizations without a learning management system, we deliver this course through our custom-built eLearning environment where we take care of user management, certificate generation, and tracking compliance to make sure your team is always up to date on GCP training. Our training is globally recognized and complies with Transcelerate's Good Clinical Practice Mutual Recognition Program. This allows our training to be recognized across the industry. If you are looking for more, our team of eLearning designers is able to quickly adapt this course to fit your organization. We can include white labeling, co-branding, addition of organization-specific content and resources, or even provide multilingual translations for our course narration. I won't keep you much longer, but let's take a quick look at the course once again before we wrap up.
Participant medical care and safety reporting. A qualified physician who is an investigator or sub-investigator on the trial should have overall responsibility for trial-related medical care decisions. Other appropriately qualified healthcare professionals may be involved in the medical care of trial participants in line with their normal activities and in accordance with local regulations. Throughout the course of a clinical trial, subjects will commonly experience adverse events. GCP requires that during the subject's participation, the investigator provides adequate medical care and treatment for these events. The investigator is also required to make the patient aware of any adverse events which occur during the trial, including abnormal laboratory values regardless of their clinical significance. It is recommended that the investigator notifies the participant's primary care physician of their participation in the study. Participant medical care and safety reporting. Adverse events and laboratory abnormalities required for safety reporting should be reported to the sponsor according to the reporting requirements in the protocol. The protocol will list out adverse event and serious adverse event definition, as well as outline what is required to be reported to the sponsor and how. All serious adverse events should be reported immediately to the sponsor after the investigator becomes aware. Some protocols may identify SAEs not requiring immediate reporting, and these should be handled per protocol requirements.
At Advantage Clinical, we know GCP, and we are ready to get your team trained on the latest release from ICH. Our course has been carefully designed to follow the guidance and is peer-reviewed to ensure the highest level of quality. We believe GCP training isn't simply a checkbox exercise, and with the latest GCP release, we understand how important it is to ensure our colleagues have a thorough understanding of the new guidance. With the new GCP release just around the corner, it is time to get ready to roll out this new GCP training to your team. Thank you for taking the time to review our course demo. Our team would be happy to show you more and take you through a tour of our course capabilities. Please reach out to us at info@advantage-clinical.com to speak with a member of our team. In the meantime, please be sure to visit our Knowledge Center at advantage-clinical.com for the latest on GCP and emerging topics in clinical research. Enjoy the rest of your day!